Well, from that to this, a new study looking at the overall effects of extreme exercise by zeroing in on ultra runners who cover distances longer than the 26.2 marathon distance, revealing a little bit about how our bodies endure with more exercise. It might actually surprise you. Joining us now, Dr. Campbell, a cardiologist and assistant professor of medicine at the University of North Carolina. And we've done a few of these stories, right, where extreme running is an issue for the heart, and you talked a little bit about that as a cardiologist. What did this Stanford focus study find about extreme exercise?
Well, they took a control group of sedentary people and compared them to these ultra runners, and they asked everything about their health, from their heart health, their lungs, their prostates, their sleep patterns, and then their training. And what they found was the ultra athletes did so much better in terms of heart attack and stroke risk, less than 1%, very, very low risk.
As they said, they asked them all the embarrassing questions that you don't want to ask. I thought it was also interesting that the ultra runners in this study were absent from work less often than American adults because of illness or injury, but they said that might be because of the mentality of ultramarathoners who say, you know, I don't need anybody's help, I don't need to go to the doctors.
I think that's true, but I think also we know that exercise boosts immunity, and when you have a better immune system that's more easily able to fight off infection, you're going to stay healthier longer. And I think that this study is really important because it shows us that you can really train hard and live a long time with good health.
And it showed that the younger ultra marathoners actually did worse than those that have been doing it for years and years.
Right, and that was the surprising part. The younger you are, the more likely you are to get injured. I think the older people have enough good sense to stretch, to not push themselves so hard, and to plod along and get the job done, but you don't have to sprint.
Experience with age is what you're saying.
Exactly.
Now, this always comes up, especially when folks are looking at new exercises for the year ahead. Is it better for me to start running and jogging? Is it better for me to hit the weights? And an interesting study was taking a look at women and the use of weightlifting when it comes to specific disease and illness. I know you're a lifter with your CrossFit, Dr.
Yes.
Campbell. Tell us a little bit about this particular study.
So we've known for a very long time that aerobic exercise, 150 minutes a week, is very important in reducing obesity and heart disease, and specifically type 2 diabetes, where your body doesn't respond to insulin well. In this study, they also added 1 day a week for an hour of weightlifting, and what they found in these women is their rates of diabetes was very, very low. It seemed to increase lean muscle mass, which made their ability to respond to insulin and resist the development of type 2 diabetes much lower.
So as a CrossFitter, the big takeaway from these two studies is what?
Do something, get up, move. Make sure that you shake it up, not just aerobic, not just weightlifting, something together. Everything in moderation.
We just have a little shot just to prove to our viewers.
Oh, my goodness.
Like, you're looking tough there, Dr. Campbell. I mean, it looks pretty serious. You like CrossFit, huh?
I love it. It keeps you young.
It keeps you doing something, that's for sure. Dr. Campbell, great to see you as always.
You too. Thanks for having me.
John, so 100 miles on the weekend, no big deal. That's what Dr. Campbell says.
Maybe on my bike.
That sounds pretty good, too.